So I'd like to welcome you all today to the launch of Pride in Prevention. My name's Marina, Carman. I'm the Director of Rainbow Health Victoria, and I'm the lead author on the resource, and I use she, her pronouns. I'd like to start by acknowledging the traditional owners of the many lands on which we're all meeting today and pay my respects to elders past, present and emerging. Always was, always will be Aboriginal land. I'd also like to acknowledge the rich history of the feminist movement and all the LGBTIQ activists who have gone before us and paved the way for us to be in this virtual space talking about these issues today. The event today is brought to you by Rainbow Health Victoria, and we're really pleased that you could all come along. We actually had over 400 people registered for the event today, so hopefully we get a good percentage of those coming along, but certainly it's a really amazing engagement with this resource and this project, so we're very, very happy to have you involved. We know we've got representation within those who've registered from across the country, even a smattering of people from overseas, depending on the time difference, and also CEOs and workers from many different organisations engaged in LGBTIQ rights, health and wellbeing, as well as gender equity, women's health and prevention of violence against women. And we were also very pleased on a personal note to see that Rosie Batty registered for this event. So Rosie, if you are here, we'd very much like to thank you for your work and your engagement with these issues. So my job, first of all, is to take you through the format for today. So to start, I'm going to give a short presentation introducing the resource. And then we have three keynote speakers joining us. First up, we have Gabrielle Williams, who's the Minister for Prevention of Family Violence. Then Ro Allen, who's our Victorian Commissioner for Gender and Sexuality. So thanks to both of you very much for being with us for this exciting event. We're also ever aware of the need to centre the lived experience of victim survivors. So we've then invited Russell Vickery to speak. And Russ is the LGBTIQ representative on Victoria's Victim Survivors Advisory Council. And after that, I'll hand over to Jackson Fairchild to lead a panel where a range of experts will talk about the implications of the resource for programs and for practice moving forward. It's a pity you can't pick up a copy. Some special people got one and it's absolutely beautiful. It's one of the best things about launches that you get to pick up a gorgeous new resource. So it's a new world and unfortunately you'll have to make do with downloading it from our website. We sent it round to the list of people registered for the event, so it's already out there. If you haven't had a chance to get a copy, then go to the Rainbow Health Victoria website and there's a news item on the front page where you can download a copy and read through it. So the resource has been produced by the LGBTIQ Family Violence Primary Prevention Project. And just to start with, I wanted to clarify what primary prevention is for those who might be less familiar with it. It's really about changing the deep underlying social conditions that drive family violence with the aim of stopping that violence before it starts. There's been a long-term engagement with the need for primary prevention of violence against women, but it's a relatively new area in terms of violence experienced by LGBTIQ communities. So we're really pleased to be undertaking this project. The project is funded by the Office for Women in the Victorian Department of Premier and Cabinet, and the project's being undertaken in two phases. The first is to produce this evidence guide, so it's really about reviewing research, investigating drivers, and building shared understandings among the sectors that might be engaged in this work. And then phase two moves on to pilot activities where we're building expertise and capacity and testing and delivering approaches. Well, we didn't start from scratch in producing this resource, and we've really drawn on any existing work we could get our hands on. That included existing research looking at prevalence of both intimate partner violence and family of origin violence, looking at the dynamics and nature of violence, and also looking at theoretical approaches to drivers of violence, particularly mostly coming from a feminist perspective. We also looked at existing policy frameworks, particularly Change the Story, which is the national framework for the prevention of violence against women. And we also undertook an analysis of existing interventions in primary prevention of family violence and also in LGBTIQ rights and health that really could be understood and reframed as primary prevention. And what we realised from all of this work is that there's a lot to be learnt when you put it all together in a slightly new way. And there are some important key insights outlined in the resource that we're really, really proud to have been able to sharpen up, and also a lot of ideas about what future research is needed in this space. So the key outcome in the resource is the development of a proposed model for the drivers of violence against LGBTIQ communities. It hasn't been done before, and it points the way towards better understanding and acting in informed ways. And really the main message of the resource is that the drivers of family violence for LGBTIQ people are the same as the drivers of violence against women, rigid gender norms, but also distinct while being inextricably linked. So cisnormativity and heteronormativity cannot exist without sexism and vice versa. So we have to tackle these issues together. So what we've put together is a roadmap for now with a view to what we can do and learn into the future. So we hope you like it. We hope it's of use to you in your work. We also hope it makes you think, and we hope you take it as an invitation to continue in what is just beginning as a conversation with us into the future. I'm really amazed at what we've managed to achieve in just over 6 months of working on this project. So before I finish, I just need to thank a few people. The project team has been amazing, a truly collaborative project drawing on researchers and experienced practitioners and policy experts within Rainbow Health Victoria and the Australian Research Centre in Sex Health and Society. But special acknowledgement needs to particularly go to Jackson Fairchild, who followed this resource through from end to end, as well as Matt Parsons' invaluable input. And really the most profoundly satisfying thing for this core team is that we all have a lived experience of family violence ourselves and can see ourselves in those drivers and what we're doing to interrupt them. So the personal meaning that we've all drawn from this work has been really immense. The project consultation group has genuinely been a joy. Don't often say that, but this one really has. Drawn from different sectors and organisations with some really constructive engagement and excitement about the project. So thanks to you all for your support. Thanks to our wonderful designer, Roseanne from Tinderspark, and Thirst Creative, who did the illustrations for us. Cracker of a job, really happy with it. And finally, of course, thanks go to our funder, the Office for Women. And we've been really pleased to receive lots of engagement and feedback from community experts and many, many different parts of government in preparing this resource. And finally, of course, thanks to all of you for being with us and helping us launch this resource. So what we're moving on to now is the first of our speakers for today. First up, we have Gabrielle Williams, who is the Minister for the Prevention of Family Violence and Minister for Women. She's also the member for Dandenong in the Victorian Legislative Assembly. Thanks again, Minister, for your support and your leadership in this area. So welcome, Gabrielle.
Thank you, Marina. Thanks very much for that very warm introduction and for the overview, which is really helpful. Before I begin, please let me acknowledge the traditional owners of the land on which we meet, noting, of course, that we're all gathering on different country at the moment, and pay my respects to elders, past, present and emerging. I also want to acknowledge the many who have lost their lives as a consequence of family violence, and the many who continue to live with the trauma of it. And sadly, the numbers in both those categories are far too high, which is a key reason, I guess, why we're all gathering here today to launch this resource. Before I get into that, I also want to acknowledge that we have the wonderful and indefatigable Ro Allen here with us, who has been a great champion, a great friend, and somebody who has taught me a lot over the years. So thanks, Ro. Of course, Russell Vickery, who sits on VSAC, also somebody I've learnt an enormous amount from since being in this role, and I might touch on that if I remember to round back to it later on, because Russ, whether he realises it or not, really did teach me a lot about intimate partner violence, and particularly within the LGBTI community, and how it was often just not recognised. And I hope to come back and touch on that a little bit as well. The team at Rainbow Health Victoria, and what a wonderful team it is, and we've got an amazing set of panel speakers here today too. So each of them as well. Look, it's such a pleasure to be able to to be here to launch this resource. And it really is, it makes it sound too stale actually to say it's a resource, because it's more than that. This is going to have life breathed into it in a way that will make a meaningful difference in the lives of so many people in our community. And that really is why this is so important. It's why it's such a strong piece of work, and as a guide, its flow-on effects throughout the family violence sector, whether that be parts of the sector that work specifically with the LGBTI community, or parts that don't and need to learn how to do that better. This resource is going to lead to better practice, and that's why this is so important. I think it's also timely, though, that we're launching this during this period of time, during this COVID pandemic, where, as I'm sure all of you have seen, where rates of family violence are trending upwards, and where international experience would tell us that we should expect that spike to sadly continue. And that also comes, of course, with an impending recession, an economic downturn, and we know that that also has huge ramifications also for intimate partner violence, or family violence, and other forms of violence that occur, largely behind closed doors within our homes. So there is no more important time for us to be talking about prevention. As many of you will be aware, in fact, probably all of you, a few years ago, the Royal Commission into Family Violence handed down its report with 227 recommendations in it, and the government committed to implementing every single one. And we did this in acknowledgement of the significance of the issue of family violence in our community. We've so far invested nearly $3 billion just in Victoria on addressing family violence. And just to put that in context, that's more than every other jurisdiction in Australia combined. So our commitment here has been, second to none, really. And it's all eyes globally on us to try and look at how this reform tracks, and how the work that we're doing, or to look at the benefits of the work that we're doing, and we hope that it's expanded to other jurisdictions as well, both nationally and internationally. But we can't talk about family violence without talking about prevention. And so much often of the mainstream focus is actually on response. But if we're actually going to eradicate family violence, both in all its forms, then we really need to, increase our efforts and hold them there in the prevention space. It's the only way we're ever going to end this once and for all. We've got to stop it before it starts, effectively. That also means upskilling our service sector to be able to know what they're looking at, to identify, to be able to educate those sectors, and also make sure that the unique experiences of individuals who are experiencing violence is understood, respected, and responded to appropriately. And, we know, for example, that people in same-sex relationships experience intimate partner violence at about the same rates to those in heterosexual relationships. Sadly, we know that for trans and gender diverse people, those rates are even higher, which is really, really alarming. But we also know that family violence is driven by, as Marina outlined, gender norms and rigid gender stereotypes that impacts on this as an issue across our community. When we look at layers of identity and overlapping areas of inequality, then we know that the impact is greater again. So, for example, people experiencing overlapping inequality are more likely, effectively, to experience family violence, and that means those who are experiencing already discrimination based on culture, on Aboriginality, ethnicity, socioeconomic status, disability, geography, age, you name it. You add the complexity of those layers, and we're seeing even worse outcomes again. I say that really only to highlight just how important this resource is, and making sure that our responses and our prevention work is appropriate, that it's tailored, and that we are, fully cognizant of those layers and of the experience of those people who need help, essentially. And that probably brings me neatly to the importance of learning from those with lived experience. And I touched on this briefly at the start in talking about Russ. And how his first ever account given to VSAC that I was privy to. So it was my first ever Victim Survivor Advisory Council meeting, and Russ spoke about what intimate partner violence looked like in his experience within the LGBTIQ community, and it touched me. And I have used that example in many times when I've spoken to others in the community to help understand how things can look different, to try and explain that sometimes there can be barriers to identification, both self-identification and identification by the service system, and that essentially then provides a big barrier in people reaching out for help when they need it. And that, to me, is an enormous barrier. It's one that we have to overcome, because the thought that people can be living with this pain in silence and not feeling like there is an option for them is just a dreadful, dreadful thought. So I know this resource is informed by those with lived experience. It's informed by their voices, and that through that input, we are now, as I said at the start, in a position where we can expand the benefits of that knowledge through our service system, through the design of different programs, and really get into the minds of those decision makers too, who are going to be really influential in terms of not only broadening our service system, but adding some depth to it as well, which is really really important. So this guide is so very important, that I'm also pleased to be able to say that we are going to provide an additional $95,000 to Rainbow Health Vic to develop and deliver workforce training that is based on this guide. I hope that's good news to all of you. I see the Commissioner clapping. It's wonderful for us to be able to support the continuation of this work, its implementation, and that process of breathing life into it. So thank you for allowing me to celebrate this launch with you today. Thank you to all those who poured their hearts and efforts and expertise into it. I think it really shows. And thank you for all of you who have made the time to log in today, for your interest in this issue, for your commitment, like each of us, and whether we be speakers or panelists in the official proceedings today, for having that commitment to trying to effectively fix this issue and improve the lives of people in our community, and do that in a way that truly recognises who they are, and does that without judgment. So thank you very much for all your work, for your commitment, and for the work that you will do, noting, of course, that when we give you money, it always means that we expect something back. Sorry about that, but I've no doubt that you will do brilliant work in continuing with this. And it's an absolute delight for me to have done my small part to bring it about. So thank you very much.
Thanks so much, Minister. And yeah, we're certainly very, very keen to keep going with this project and to make good use of any money that comes our way. So next we've got Ro Allen, who is Victoria's Commissioner for Gender and Sexuality. Ro was appointed to this role back in 2015 as Victoria's first such commissioner, and I think probably Australia's first such commissioner. And the profile and advocacy that Ro has brought to LGBTIQ family violence as an issue has been really, really important. So thanks very much, Ro, and welcome.
Oh, thanks, Marina, and thanks for having me today. I'm coming to you from the land of the Yorta Yorta, and I want to pay my respects to elders past and present. Always was and always will be Aboriginal land, and I'm really proud to represent a Victorian government that's working on treaty with Aboriginal people. I know we've got a long way to go in that space. Like the Minister, I also would like to acknowledge those we've lost through family violence and those survivors. And, we've got a lot of work. This is a great piece of work today that we've launched here, and I know it's going to make such a difference in the life of survivors and in our community. Minister Williams, what else can I say? You've done my job for me. I feel like I can go home. And for everybody in Victoria, outside Victoria, how jealous are you of having a family violence minister that has LGBTI issues at the core of her understanding? What else can I say? You're amazing. Thank you for the money into the sector, because it's not in Victoria, it's not an add-on, it's part of the LGBTI, it's part of the family violence work. LGBTI is just included in that. And we're so lucky to have that in Victoria. Don't worry, it's free, isn't it, Marina, to download to everybody else? It's our gift to every other state and internationally. It's our gift to you. And take up that challenge. I think the resource says there's more research. We don't have to fund everything in Victoria. Get on with it. Partner. Congratulations to Rainbow Health Victoria. I really want to say what a great resource. You do us so proud. And you've showed us what we've already known for some time with an evidence base, and that's what helps our arguments for funding and for everything else we do. We know the drivers are similar to heterosexual cisgender families. We know that our family violence has increased in our community within the COVID period of time, and we've got to have those hard conversations. Russell, to you, you won't know the depth of the impact of your stories, your cabaret show around family violence, the way that you are able to deliver the message, because these are really difficult conversations. We were having these conversations during the marriage equality campaign when people were saying, no, we can't talk about our relationships as being negative. We have to be lifting up the positive stuff. And you were able to cut through that and be such an advocate in the space. And I know that it comes at a cost. I know that every time you tell your story, every time you come onto one of these panels, and I just want to acknowledge you and all the other advocates in this space, because that's how we've advanced in Victoria, because we've had people brave enough to stand up, follow in the footsteps of Rosie Batty, and from our community being those champions. So thank you to you. I want to also just acknowledge those who are working on the front line in family violence, as well as the research and evidence base that's enabled us to put a demonstration project in place. So can I just do a shout out to Drummond Street Switchboard, Thorn Harbour Health and Transgender Victoria that have been working on the front line in this space. Well, it is, we have come a long way in Victoria. I remember when I first took on the role, as you said, in 5 years ago now, we didn't have anything. We didn't have an LGBTI family violence sector. And in fact, we looked to New South Wales for some of the research. We have developed a sector, and Rainbow Health Victoria, this prevention initiative, this resource will enhance that sector. For those that are joined online that are part of mainstream services, thank you for participating. Thank you for finding the time. And we know that it is difficult for our community to go into family violence services and feel included. And so this might give you the evidence base to take it right up to your boards, take it right up to the management and leadership in your organisation to say, here are the drivers, here's the evidence, this is the work that we need to do. For LGBTIQ organisations, we've got to have these conversations. And now, again, we've got the evidence to put our arguments together and to educate our own community, because we know that minority stress can lead to internalised oppression, and that can lead to violence. We've got to have those hard conversations. Women in our community can be perpetrators of violence. In our relationships, our lesbian relationships, both parties can be perpetrators and victims. They're complex situations that we need more work to work through, and I know that this is as a great stepping stone to that today. So again, congratulations to everyone. There's not much more to add except download, 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 share, share, share. Marina, I hope you can monitor how many are from Victoria and how many go international in the downloads. Don't you think, Minister, we need to see what sort of export capacity we've got going on here? But it's because we have champions in the space. We're supported by a fantastic sector, an awesome government that gets behind our sector, and people on the ground and advocates that are doing the work. Couldn't be prouder of the work we're doing. And I know that this is a day and this is a resource that will help us in our work in this space. So congratulations to everybody involved.
Thanks so much, Ro. Really appreciate it. So next up we have Russell Vickery, who is the LGBTIQ representative on Victoria's Victim Survivor Advisory Council. As Ro mentioned, Russ is also the star of My Other Closet, the Cabaret, and was the first queer survivor to share their story on national television last year when he appeared on ABC's You Can't Ask That. On behalf of Russell, we'd like to advise that the story of his lived experience includes descriptions of family and homophobic violence. Thanks, Russ.
Thank you so much. What do you say when you have people introducing you with that sort of gusto? And thank you so much, Gabrielle, and also the commish for those lovely words. We all have to remember, of course, that none of this can happen unless people at the top end of government are there to support. So huge thank you to both of you for everything you do to enable all of this to be happening for us today. I'd like to start by acknowledging the traditional custodians of the land on which I and each of you stand today, and pay my respects to elders past, present and future. I also wish to extend that respect to Aboriginal and Torres Strait Islander people who are tuning in with us today. My name's Russell Vickery. I use he, him pronouns. And of course, I am the LGBTIQ rep on the Victorian Government's Victim Survivor Advisory Council, or VSAC. I am grateful to the generations of LGBTIQ people who have fought for our rights and equity, as well as the generations of feminists whose fight has gained the ground on which the family violence sector is built. It's the coming together of all of these efforts that enables a role like mine to exist. I feel humbled and privileged to fill this role, and I strive to ultimately represent and honour the many LGBTIQ victims of family violence whose voices will never get to be heard. Most LGBTIQ relationships are respectful, loving, and worth celebrating. But some relationships are based on power, control, fear, and abuse. I know this all too well because, of course, I myself am a survivor of physical, emotional, and psychological abuse in a gay relationship. Usually when I'm asked to speak in my role as a VSAC rep or get on stage with my show, My Other Closet Cabaret, I tell a story of what went on in my abusive relationship. But while I was reading Pride in Prevention, I saw this relationship in a bigger, wider context. So instead, I'd like to tell you about some other parts of my life story that came to mind as I read this guide. I was born in the late 1950s. I know, that makes me very old. When I was a small boy, I can remember a few schoolyard fights being dismissed by the adults with "boys will be boys," and being told that big boys don't cry, no matter what. By the time I'd completed primary school, I'd learnt what seemed like very important lessons about being a man. Don't be too weak, don't be too feminine, and don't be too gay. Of course, this was also at a time where Australia was still blatantly and violently homophobic, and it was in fact illegal to be gay. When I was a teenager, my high school years are full of memories of being dealt with as less than. I was singled out for being too gentle and more interested in drama club than football, so therefore automatically classified as a queer. This is well before we reclaimed that word, and it was still only a derogatory term. A term used along with pufta or sissy or pansy or faggot. This package of labels was thrust upon me for not being masculine enough before I'd even had the time to consider what my own sexuality was. When I was 18, I was so grateful when high school was over and I could move out into the big wide world and even find other people just like me. During this search, my most violent experience of not belonging occurred. I was having a cigarette outside a gay club in St Kilda, and I'd been at this gay club called Pokies. Two men came rushing towards me and flashed a badge at me. They grabbed me and they threw me into the back of a car where two other men were waiting. And they drove me to a deserted car park. They dragged me out of the car and I was held down and I was kicked, and I was punched, and I was beaten to a chorus of comments about how they were giving a faggot what he deserved, and what a great night out it was for them, pufta bashing. Thankfully, they seemed to tire of it before they actually killed me. I was a bloody mess, but I managed to get myself to a main road where the first passing car stopped and offered to take me to hospital. I was too afraid to go to hospital because it may have meant outing myself. It was still illegal to be gay. And what if the hospital staff also thought that I'd got what I deserved? And besides, big boys don't cry. Even though I was quite seriously injured, I convinced the driver to take me to a friend's house instead. When I was in my early 20s, many of my friends started to mysteriously get sick. These young men were perfectly healthy one day, and the next day they were dying. We didn't know how or why. We just saw this terrible sickness and death decimating the people that we loved. The HIV/AIDS epidemic had hit, and it was terrifying to be queer. Many referred to it as gay cancer, and it seemed that the general consensus was we were getting what we deserved. As I approached my 30s, I met a woman at work, and that meeting eventually led to marriage. Once I was married, the world saw me as heterosexual, and I felt the safest and most accepted I'd felt in my entire life at that point. Seen as a straight man, I felt I could go anywhere and do pretty much anything, and I was safe and accepted. My life conformed and fit into the box the world had always been pushing me towards. Truthfully, I'd loved my wife at the beginning, but over time, this relationship developed the inevitable cracks until finally it was clear that it would be best for all of us if we parted. So then, during the divorce, when I was in my early 40s, I came out as gay. Coming out doesn't come with a manual. It's equal parts exciting and terrifying. And I think abusers are good at looking for these things. Vulnerability. This is when the abuser stepped into my life. I was hoping that my first gay relationship would be the happily ever after part of the fairy tale that I'd been looking for. My abuser and I were both raised in a homophobic world where violence against gay men was normalised. My abuser made a choice to control and abuse me. But without homophobia, perhaps he would have been less enabled to do so. Without homophobia, perhaps he wouldn't have had so many tools on hand to hurt me and to control me. All he needed to do was echo back on the messages I had already been programmed to receive, and I would believe him. When the physical violence started, he told me that since I'd never been in a gay relationship, I wouldn't know. Two men are in a relationship and arguments turn physical. Boys will be boys. And no matter how much he broke my bones or my spirit, big boys don't cry. Then, when I was so desperate that I finally reached out to a service for support, they told me, we don't have the capacity to deal with people with your lifestyle. My perpetrator had already made me feel worthless. So when the services only offered homophobic rejection, well, that was it. What else could I feel except hopeless? I was just getting what I deserved. Without those rigid ideas about what makes a real man, perhaps I would have received the help I needed. I spent a long time during and after the relationship wondering what I could have done differently to have maybe avoided the situation, or how I could have got out earlier. I've since learned that it was never my fault. What I see in Pride and Prevention is that actually the situation and all the things that led to it never should have happened to me in the first place. To me, this resource is a roadmap to a place where other LGBTIQ people won't have stories like mine. And I hope today is the first step. Pride and Prevention points us to a place where LGBTIQ people not only live free from violence, but where all bodies, genders, and relationships are celebrated equally. It sounds like a destination worth striving for, doesn't it? And a journey that I'm pretty excited for all of us to be taking. Thank you so much.
Thanks so much, Russ. We're really grateful for your commitment and your courage in telling your story. And it's definitely those stories that we've tried to hold and do justice to in preparing the resource. And I think the power of prevention is that you do have that chance that it perhaps doesn't happen to someone else or doesn't happen to a whole group of people. So that's certainly what we're aiming for with this resource, and the amazing feedback that we've had from people has really come from that place. So we're going to move on now to the next part of our event, and that's a panel. So I'm going to hand over to my colleague Jackson Fairchild, who's the Head of Policy and Programs at Rainbow Health Victoria. Jackson will be speaking with 4 expert guests, including our partners in phase 2 of the project, and also organisations that are playing a leading role in the prevention of family violence. So thanks very much, Jackson.
Thanks so much, Marina. Yeah, I'm wiping tears away from my eyes for that last section of today. It's always incredible to come in on the back of the voice of a victim survivor. And before we move ahead, I just want to thank Marina for her leadership and of this project. We're very proud of the work that we're doing, and it's just fabulous to be here today. And as we heard earlier, part of the work that we are so grateful for is the opportunity to work alongside and in consultation with some really amazing leaders in this space through both our consultation group and through the next phase of the project. So without further ado, I'd just like to introduce our guests that are here today. I'd first like to welcome Star Lady from the Zoe Bell Gender Collective, which is a trans and gender diverse advocacy organisation and one of the partners in the next phase of this project. Star Lady is a social justice advocate who's passionately committed to addressing discrimination and prejudice throughout our society through her work in advocacy, education, training, and community development across a range of health and community services. So welcome, Star Lady.
Thank you.
I'd also like to, it's lovely to have you here. I'd next like to welcome Carolyn Gillespie. Carolyn is a social worker, intersectional feminist and human rights advocate with more than 20 years experience in healthcare and social justice locally and internationally. Carolyn comes to us today as the Director of Services at Thorn Harbour Health, another of our partners in the next phase and one of Victoria's largest community-based and community-controlled LGBTIQ organisation. I also want to note that Carolyn comes from a background as being the convener of the Victorian Peak Organisation for Sexual Assault Services, the CASA Forum, and was leading a major sexual assault service during that time of significant state and national reform in recent years. So welcome, Carolyn.
Hello, happy to be here.
So wonderful. Next, I'd like to welcome to people who come to us as from organisations who are leaders more broadly in the field of the prevention of violence and specifically the prevention of violence against women. I'd like to welcome Dr. Stephanie Lusby, the Director of Prevention of Violence Against Women Programs at the Domestic Violence Research Centre Victoria, which we also all know as, or many of us know as DVRCV, which is a leading statewide family violence organisation working across service response and primary prevention. Her background as a social researcher, development practitioner and program manager, and has worked in the primary prevention of women and gender and social change, both in Australia and across the Pacific for more than 10 years. So welcome, Carolyn.
Thanks, Jackson. Great to be on the panel.
And last but certainly not least, I'd like to welcome Dr. Shane Taz, Senior Policy Advisor, Masculinities at Our Watch, an independent national organisation working to prevent violence against women. In this role, Shane has been project leader and author of the evidence review Men in Focus, launched in 2019 by the Victorian government. Shane also advises on and helps develop plans and practice resources relating to masculinities and engaging men and boys in prevention. So thank you all for joining us here today. And I just wish we were all sitting at a beautiful table, all here physically together, but I think we've all gotten quite good at finding our way of speaking and doing our best across this strange digital realm which we all operate at this crazy time. So we've got some questions here today, and because of the nature of this, I will just take turns and ask people to respond individually to each question, but I do invite colleagues, if there's anything you'd like to jump in after each question, please feel free, as we also want to welcome a bit of conversation in this space as well. So I'd like to start with Carolyn. You're join us here from Thorn Harbour Health. Can you tell us a bit about your organisation and how the Pride and Prevention Guide relates to your current work?
Yes, excellent. Thanks, Jackson. And as I mentioned before, really thrilled to be here and incredibly excited about the guide. So for those of you who may not know, Thorn Harbour Health's been around as an organisation for almost 40 years now. Initially as the Victorian AIDS Council, and was founded as a community response to the HIV and AIDS crisis. But over the years, of which there are now many, we've expanded to run a whole range of health campaigns, services and programs for the wider LGBTI community. We had a rebrand back in 2018, so we went from Victorian AIDS Council to VAC to Thorn Harbour Health, really in recognition of the diversity of our work, and we remain proudly a community-controlled organisation. And now our remit is very much to improving the health and wellbeing of all sex, sexuality and gender diverse communities, and continuing our work supporting and advocating on behalf and with people living with HIV. So as part of our work, we do some family violence work in a whole range of areas, including for victim survivors, importantly, a range of recovery-based work, casework, case management. We have flexible support packages to support people to leave violent relationships or situations of unsafety. And we also support partners of the men participating in our behaviour change program. So some of the funding for those services came as a result of the Royal Commission findings and the need for a specialist LGBTI service, but the organisation for a long time has provided a men's behaviour change program, our revisioning program for men, queer men, LGBTIQ men who are using violence. And we also provide some support in that space around financial support and case management to increase program engagement, reduce risk, and to provide some counselling and therapeutic support. Alongside our direct service work, and where this guide really fits in for us, is that we have always remained an activist and advocacy organisation. So we're not interested in just providing responses at the bottom end of the cliff, but actually to contribute to policy reform through provision of submissions, guidance and advice to government panels, inquiries and a whole range of working groups. So for us, the guide, when I was looking through, and I agree with Marina, it's very beautiful, which is always lovely, but it also has incredible content. And what I think it does for us is it actually integrates and builds on the current frameworks that exist around understanding the drivers of violence, and provides an LGBTI lens and framework around that work. And it provides us with some really clearly outlined ways in which the drivers of violence manifest in our LGBTI communities, and provides an excellent resource for mainstream services to assist us in our shared advocacy to see the end of family violence. And really, I think one of the key things that's useful for us is it provides some clear information around the unique ways in which family violence is experienced by LGBTI communities. And there are many shared drivers, but there are really unique experiences as well. And I think that's articulated clearly in the document, and provides a conceptual model for us to note the drivers and the priorities for us for our intervention. But also it outlines the gaps and calls for action. We know that LGBTI people sometimes don't appear in research, and it provides us with some action and a call to really increase our data in this space and some evidence to step off for the next phase of the work.
Thank you so much, Carolyn. What a fantastic summary of the amazing work that Thorn Harbour does across this space. And I'm really struck by already and how much ahead we are, but also how far we have still to go, and just how much LGBTIQ orgs are capable of doing on the smell of an oily rag within that space.
Yes.
But how much, really hearing that need to work together and to build and go further and build upon that learning that's already occurred. Next, I'd like to welcome Star Lady from the Zoe Bell Gender Collective. Star Lady, welcome. So wonderful to have you here today. And I'd like you to ask you that same question. Can you tell us a bit about your organisation and, a little bit about how this guide relates to your current work?
Yeah, so the Zoe Bell Gender Collective is a trans and gender diverse advocacy organisation. I myself identify as, a trans woman or as trans feminine, and we work with health and human services to provide education, training, and secondary consultation to organisations and individual practitioners who want to develop their trans and gender diverse inclusive practice. We also engage in human rights advocacy with and for the trans and gender diverse community, and we also provide youth-based LGBTI and trans and gender diverse workshops for young people. Today I'm going to be talking about the experiences of trans feminine people, trans women, and women who may have a trans and gender diverse history or experience but don't identify as transgender. For the purpose of today's presentation, I'm going to be using the word trans woman to reference all of these identities and experiences.
Thanks for that.
I'm also going to be talking more about intimate partner violence rather than broader family violence. And so the ZGBC has worked in delivering training and advocating for the development of trans and gender diverse inclusive practice in both sexual health services and family violence services for a number of years. We've had the fabulous experience of working in particular Caroline within Casa House, for a number of years. In terms of our position and framework, so that misogyny and patriarchy impact all women, including trans women, and the rights of women and trans and gender diverse people are not mutually exclusive. In fact, our movements have a commonality. We have wisdom and skills to share with each other, and we most definitely have a shared struggle. The ZGBC in particular has significant cultural knowledge around cisgender men's violence against trans women. We have a deep understanding of how transphobia in our society creates and perpetuates the internalized shame that cisgender men experience that contributes to the violence against trans women. Shame and stigma add another layer of complexity and amplifies the violence against trans women. I want to be clear in communicating that this shame and stigma that I'm talking about comes from all aspects of our society, and that as a society, we need to begin to take responsibility for the violence enacted against trans women that is compacted through shame and guilt. The perpetrators of violence against trans and gender diverse people know all too well that we have very few means to seek support or justice, as transphobia is also the very reason we're excluded from the institutions that society has set up to protect vulnerable people. On a systemic level, we need to acknowledge that transphobia is embedded within all of our systems, and that the enactment of justice takes courage, time, and perseverance. For us, this guide, gives us a buy-in to a sector and to places that gives us a buy-in. We've often been erased or we've been ignored. The guide for us reinforces what we already know and what we live, and that transphobia and cisnormativity are drivers of violence and tools of oppression. Thank you.
Amazingly said, Star Lady. Thank you so much. I'm so glad we're recording here today. Thank you so much. There's a lot for us to think about, and we will dive in a bit more into those points that you just covered there in the next question. I'd like to ask Steph, if you could, we could hear a little bit more about what it is that your organisation, about DVRCV, and how Pride and Prevention relates to the work that you're currently doing.
Great, thanks Jackson. And again, it's such a privilege to be part of your lodge. Congratulations, Rainbow Health, and to be on a panel of this calibre as well. It's really exciting. So DVRCV, as Jackson mentioned, is a statewide specialist family violence organisation, and we work across prevention and response. I also want to add that we are currently in the process of merging with Domestic Violence Victoria, which is the state peak that represents family violence response services, which is hugely exciting and is going to be an opportunity for us to increase the potency of our shared efforts to prevent and respond to violence against women and family violence in the state. The core of our work at DVRCV is building the capability of people who work to prevent and respond to violence against women in Victoria. So this means a lot of different things. It means delivering training and professional development, and also providing spaces for knowledge sharing, like communities of practice, networking events, and online spaces, particularly at the moment, and seminars and conferences and different events, and also developing and providing tools, resources and guidance for professionals and services working across prevention and response. A massive part of our work as well is listening to what we hear through seeking advice from those professionals that we work with, and working with them and across the sector to push for effective systemic level reforms and social change. And so being able to participate in conversations like this are also massively helpful to that work, and help to broaden that scope. Pride and Prevention is such a wonderful resource, and we've been really privileged to be having some great conversations with Rainbow Health, and including some public conversations around the crossover between our work and, as I said, our particular focus and the particular focus of my team on preventing violence against women, and looking at how this work from Pride and Prevention gives an added depth to our analysis of structural inequality that drives violence against women and family violence in all of its different forms. It's already pushed some really interesting and important conversations within our prevention team and with our colleagues in the prevention sector about how we talk about gendered inequality in ways that recognise those overlaps between the drivers of violence against women and violence against and in LGBTQI communities. I think one of the things that there's been said a couple of times today already, and I'd really like to reiterate, is that I think some of the commonalities that are drawn out and are given in evidence in Pride and Prevention, I think many of us intuited already. We knew that, you know, and it but having that ballast and scaffolding to be able to draw the lines with conviction is incredibly helpful. And I think mapping out the kind of the different tools that we can share across mainstream practice and support each other's work is going to be incredibly useful for both sectors, but also I think, you know, more broadly for everyone that we service in the state. And so it just for me, I think the way that the Pride and Prevention Guide relates most to our organisation's work is it's a really exciting jumping off point in lots of ways to some really important conversations.
Thanks so much, Steph. And I think that word conversations just really jumps out there. This is not the first time this conversation has been happening. As we've heard today, people have been talking about LGBTIQ family violence for a long time, and particularly within the trans community, the issue of partner violence has been spoken about it again and again, a lot of wisdom within that space. And we're hoping that this resource will be a bridge to bring together conversations, experience and practice. And we know there's going to be lots and lots more talking. We're excited there's going to be some more training, as we heard about earlier today, but hopefully lots of opportunities for us to all come together and have those conversations, Steph. Lastly, Shane, I'd just like to ask that same question of you as well. If you could tell us a little bit about your organisation, about Our Watch, and a little bit about how Pride and Prevention relates to the work that you're currently doing.
Yeah, sure. Yeah, thanks, Jackson, and thanks for having me on the panel today. Firstly, yeah, I want to say congratulations to Rainbow Health, to Marina and yourself and all the team. And it is so pretty, and I know so many people have said this today, but so beautifully presented, and that always, you know, it's such a pleasure to scroll through it as we have to do at the moment online. Yeah, as far as Our Watch, to give a description of our organisation, I know some of you have worked with us and are very familiar with our work. I know quite a lot of our work is featured in the guide as well. But we're the national organisation for the prevention of violence against women. So our mandate is to address all forms of violence against women. And we're established really to drive that nationwide change. So that requires addressing the norms, the structures and the practices that lead to violence against women. And importantly, we use evidence-based research to do this. And also crucially, we do this alongside and in partnership with many different stakeholders so that we can work across the population and at all the levels of society, so policy, institutional, systemic, you know, in all the settings that we talk about through public education campaigns and supporting community projects and so on. So, you know, it's a lot of work, obviously, and a huge mandate. But talking about to talk a little bit about this guide, and given that it's a researched evidence guide, I thought I would I'd briefly touch on how the guide relates to some of our key pieces of research and key frameworks.
That'd be great.
Yeah, we'll firstly change the story, which I know is you know, is referenced in the guide. And many of you will already know this is the National Framework for the Prevention of Violence Against Women, developed in 2015. Now, importantly, the framework adjusted or it acknowledged that we do have significant gaps in the evidence base regarding women who are not cisgender and heterosexual. And also acknowledges that significant violence is experienced by people who identify outside of or don't conform to the binary definitions that are often imposed. But we can see that, you know, as Steph was saying, we can see there is a lot of overlap with the drivers and also, you know, significant overlap in the kinds of strategies that are needed to prevent violence against women and violence experienced by LGBTIQ communities. I noticed also in the guide, there was mention of the 2017 paper, I think it was, which was produced in partnership with Dr. Horsley and GLHV, which is now Rainbow Health. And that was a literature review examining the primary prevention of family violence against people from LGBTIQ communities. This research also acknowledged and really synthesized the evidence that, you know, that we have to show that there is significant overlap between the gendered drivers of violence against women and violence against LGBTIQ communities. And there were some key recommendations. You know, there was a call for more funding and support for further research in this area, for, you know, the development of specific initiatives and campaigns, and also how best to integrate, you know, this into more mainstream prevention. And I think this guide is really bringing this together. It's really a manifestation of some of those recommendations. We also in 2019, and Jackson, I know you're very familiar with this resource, but we launched Men in Focus, and it was really great to hear Russell and hear his lived experience and particularly what Russell had to say around masculinity and the pressures to adhere to particular ideas or particular forms. In this resource, we did an evidence review where we developed a deeper understanding of the links between these dominant ideas of masculinity and violence against women. And Jackson sat on the advisory group for that resource. But again, we found this significant overlap in the drivers. And in this particular review found that these dominant ideas of masculinity are very intimately linked to sexism, homophobia, biphobia, transphobia. And then the resource suggests that we need to challenge this attachment to these dominant ideas, that we need to challenge essentialist understandings that we have as sex, gender and sexuality, and that we need to aim to be gender transformative in our work. So all as key way forward. And pride and prevention, you know, oh, yeah, sorry, Jackson.
Could I just ask, could you just give us like a 2-sentence or 3-sentence description of what you mean by gender transformative?
Yeah, so, I mean, taken to the logical conclusion, it's really about challenging, you know, our attachment to these categories that we have around sex, gender and sexuality. You know, we have this, I know it's called in the research, the heterosexual matrix, where we say that there are two, you know, we think in binaries that we're born male or female, therefore you have this gender, you'll be masculine and feminine, and you'll be heterosexual. So to be gender transformative is to actually really emphasize the social construction of these categories and to really challenge some of that rigid attachment to these ideas. And that's in our norms, our practices, but also in our structures, because our social structures and the norms, they mutually, you know, they reinforce each other. So really this evidence guide and all the work that is led by LGBTIQ organisations is at the forefront of that, you know, really challenging and really doing that gender transformative work, which is so important.
Thanks so much. Yeah, sorry, I didn't mean to interrupt, but I just wanted to...
No, that's all right. And yeah, and I suppose just finally, just regarding the guide, I mean, when we look at all of our resources, you know, this guide is so timely. It's so important in the way that it starts to develop that deeper and shared understanding of a lot of this, you know, as Jeff said, a lot of these things that we feel we have already known about the drivers and the overlap and the actions that are required to address these forms of violence. And it's just great to see that this is being led by Rainbow Health, you know, in partnership and consultation. Our watch acknowledges that we're not best placed to do this and it needs to be led by LGBTIQ organisations, but we also recognise that our evidence base is highly relevant and that we have significant, you know, expertise to offer, particularly in how we address those gender drivers of violence.
Absolutely. And, you know, thank you so much for speaking so eloquently to that. And, you know, we really do want to acknowledge the incredible work of our watch and of Change the Story in setting up a kind of language and framing, which is one of the sort of skills and knowledges that we're hoping primary prevention of violence against women organisations and LGBTIQ organisations can really benefit from each other. Star Lady.
Yes.
Hi there. I just wanted to ask you, we were just hearing a little bit more from that from that framing. We've heard from Steph and Shane speak really beautifully about the work that's happening in that broader space. I'm curious for those, for you as an advocate on the ground doing this incredible work, working with trans women, working with and hearing their stories, hearing about their partners, their experiences through the world, the experience of transphobia. Shane just touched on a little bit about the role of transphobia and homo and biphobia in gender more broadly. Can you speak a little bit about how the guide how you expect it might influence change?
Yeah, totally. I mean, I think we first need to acknowledge that there's a real sort of lack of research and understandings in and around the primary prevention of violence against trans women. And, you know, as a trans and gender diverse organization, we spend so much of our time focusing on the impacts and outcomes of transphobia. And that might be like teaching organizations how to better respond to trans and gender diverse people who are survivors of sexual and intimate partner violence and street-based harassment, or it's talking to trans and gender diverse people about how to be resilient in the face of transphobia, that we rarely get time to be able to address the drivers of that violence and oppression. Unless we address that, things will actually never change, you know, for our community. So in terms of that, I feel like for us, it gives us a framework in beginning to be able to have some conversations in our community, you know, addressing the impacts of transphobia. And so we'd like to use those frameworks to talk to trans women about their relationships with cisgender men and how stigma, discrimination, and shame are impacting them. How does this look different within our community depending upon people's identities, their bodies, their presentation across age groups and cultures? We want to talk to trans women about what do they want to see change in society? What do we need to teach society about how transphobia is impacting us and our relationships? However, significantly, we also want to be talking to cis men, in particular cis men who might identify as heterosexual, because they're the missing people in this conversation. And that's definitely where we need assistance from the primary prevention sector, because cis men who date trans women don't often identify as part of the LGBTIQ community. They may identify as heterosexual. And so they don't often access LGBTIQ services or the information that comes along with them. And so some of our services, I guess, have historically worked with men who have sex with men. But the LGBTI sector broadly isn't necessarily doing a great job or historically with engaging cis men who date trans women. In fact, no one is. And so how do we reach this community? Many of them won't openly identify as even being attracted to trans women or having relationships with them, but many cisgender heterosexual men are dating or having relationships or are attracted to trans women broadly. And so we want to talk to these men to hear about how stigma has impacted them and how did they overcome, for some of them who are in like healthy, open, loving relationships, how did they overcome any sense of their internalized shame? And what could be the messaging that we could produce that could help overcome the challenges that other cisgender men might be experiencing. We'd like to hear and see positive stories and have positive representation of our relationships, trans women's relationships with cis men. We just don't broadly see any of that anywhere in our society, and we need to produce it. And I guess that we're 20 years behind, or we're significantly behind the primary prevention space of violence against women. We're going to need to like consult and gather those stories and evidence. But I also just want to like acknowledge that, you know, it mightn't be safe for cis men in our society to openly talk about their attraction or their relationships with trans women. For many of them, there also might be a real risk in them facing prejudice, discrimination, violence, and rejection. And we don't talk about that. And I think it can have a real, you know, I know from my own relationships, you know, with cis men that, you know, I'm talking to them, they don't feel safe. Some of them feel quite frightened if their communities find out about that information. And, you know, and that too, I think contributes to sometimes the secrecy, you know, of relationships. And when you have secrecy, when, you know, cis men aren't open about their relationships with trans women, it's all secret, it's all hidden from society, we create real imbalances of power. And that imbalances of power leads to real risk for trans women. And so how do we shift that? I'd love my relationships with cis men to be open, to be in public. But, you know, for many of them, that is not a possibility. And I sadly see that that is a real challenge within, you know, my life. And I don't necessarily know that will change unless we begin to do something about it. But I don't see any of these campaigns in our society, and I just haven't.
Thank you so much, Star Lady. I think what you've said is really important, and we, you know, those real experiences, those struggles, those voices, those conversations, and the importance of actually reaching the people who are driving this violence, who are committing this violence, and the importance of getting out there and figuring out what are the forces in their lives that we need to address to stop this from happening is absolutely important. And what you said about the difficulties and challenges of getting there, but the absolute importance, that kind of moral imperative to reach out, you know, and to prevent that now, because we are 20 years behind, as you said. I'm just mindful of time today, everyone. I know we could probably talk for the next 2 hours, but I'm just going to do that my good facilitator duty and remind us all that we have about 15 minutes left here today. Invite Steph to speak on a little bit about what this guide means for DVRCV in terms of influencing or changing things.
Oh, thanks, Jackson. I think one of the many things that I've been reflecting on in preparing for today and reading this guide is how the prevention sector, the mainstream prevention sector, often talks about itself as an emerging sector, and so it's kind of it was striking, Star Lady, to hear you remind us that, you know, we're 20 years down, and I also thank the several speakers today who've acknowledged the work of feminist leaders over the decades to get us to the point where you know, we're looking really comprehensively at this really important evidence base. But I also don't think it's an indictment on us to talk about prevention as an emerging sector, because I think that shows how reflexive and adaptive it is, and it needs to be. One of the things that we know, both in working in prevention of violence against women and in prevention of LGBTQI violence, is that we need to be responding to different kinds of backlash and resistance that comes up in this work. And I think for community organisations and in the prevention sector more broadly, we have different strategies, and we draw on different evidence base, and we draw on different experiences for those responses. And I think that what this does in bringing our work into conversation with each other and finding those overlaps and starting to share some of those tools is that it means that the work that we do has such a potential to be more than the sum of its parts. So I think one of the things that I've been thinking about is how, you know, it's clearly articulated in Change the Story, is how crucial it is that all prevention work is inclusive and intersectional. And there has been, I think, and I don't think that I'm being unfair in saying this, a lot of right intention around that, and a lot of struggles in how to consistently and comprehensively put that into practice in our prevention work. And one of the things that I think Pride in Prevention offers us is, because of the clever way that that you've been able to map and demonstrate the drivers of violence in LGBTIQ communities and violence against women, is that we now have, it creates a shared language and a shared way of talking, and then the expansion that broadens our practice and shows us the opportunities to share some different ways of interrupting those particular kinds of violence that occur for different people. So again, like, and the phrase that keeps coming in up to me is weaving threads. You know, like I think that there's such a shared power in being able to do some of this work together. Yeah, so it's I think that it's already starting to influence and supplement the way that we're thinking about our practice moving forward even into this planning period, and that's tremendously exciting.
Thank you so much. I'd just like to, just thinking about what you just said and that reflexivity and the importance of us being able to keep rolling, keep growing, keep being able to have these conversations and learn from each other. It's just so wonderful to hear that so beautifully phrased, Steph. So we might need to start our just towards the end, but we are mindful of time, and we know we could all speak at length about all of this, and we know this is also just the beginning of our conversations here today. Shane, I'd like to just ask you, for you and Our Watch, you know, in terms of what this means, the conversations that we need to have about shared dialogue, what might change, what's happening in the future, what's coming to mind for you?
Yeah, I think just to add on to what Steph has said, we're already seeing in our work, in our practice work, and in some of the research and frameworks we're developing, that we really need more help, I suppose, to articulate, you know, this overlap and this crossover. And particularly in some of our practice work, I'm thinking of the university setting in particular. You know, there's a lot of interest in how we might develop an inclusive whole of university approach that is focused on addressing the gender drivers of violence against women, as well as violence experienced by LGBTIQ communities. And then this guide, of course, is something we can really learn from and help, you know, and we can integrate it into that work and promote and encourage other stakeholders to use. I mean, also a really important point to say is that Change the Story is going through an update. And it's currently being reviewed. Of course, this piece of evidence, it's great. We just hand it straight over to the consultants to integrate this, you know, and find the best way to integrate that and improve the framework. So that's all going ahead, and hopefully all going well. You know, we'll have that next year. But as far as, yeah, our, like, you know, our shared future, I mean, as everyone has been saying, this is mutually reinforcing work. And I think this guide articulates this beautifully, you know, that we're drawing from a similar toolbox. We're addressing gender inequality and the gender drivers. We're working against the same systems, structures, norms, and practices. You know, that gender inequality is not only based on disrespect towards cis women and girls, but it's also based on binary understandings and hierarchical understandings of sex and gender, based on the assumption that heterosexuality is, you know, the only legitimate sexuality. All of this is intimately linked. We're all already doing this gender transformative work. And of course, anywhere that we can build the evidence base and we can coordinate our efforts is just so important and absolutely crucial for the prevention sector.
Thank you so much. That's really beautifully said. And it's so exciting to hear about the next stage of Change the Story, and wonderful that sequencing is sometimes the enemy of this work and things come out in the wrong order and you think, oh no, if only we'd had this earlier. So wonderful that we're able to pass that over to you now to look at how that can land in that broader national context. So thank you so much, Shane. We are heading towards the end of our time here today, but I did want to Star, if there's anything you'd like to say as we move towards the end of our time today about the next phase and the future, in terms of what the different, we've talked already about a lot about what the different sectors might be able to offer each other in this work and where we might go in the future. Is there anything further you'd like to share with us before we wrap up?
Just like to chuck over to Carolyn, because I feel like you haven't had enough space. So
I was just about to do that.
Sorry.
I know,
Feminism
we always have so much to say between you and I. Thank you kindly. Look, really for me, just reaffirming everything that we said, I think what the guide does, and this conversation reaffirms that we're, whilst we all come from lots of different places into being the work, we have a few key united goals that, firstly, we all want to see excellence in care and support for victim survivors, and that we hold whatever those victim survivors might be in terms of their life experience central to our thinking and our decision making and the policies and other decisions that we make. We all want to see perpetrators held accountable, and for all of us to better understand the drivers so that we can better intervene and prevent violence from occurring in the first place. And we all want to continue to actively advocate for a political and social system reform. I think we have a shared vision between specialist services and mainstream services, and having worked in both spaces and having had that privilege, that collective vision that we share is really a world without violence, where all people live with safety, with dignity, and can live meaningful lives. So I think, as other panel members and other folks today have said, for me, really, the guide and this discussion is really the beginning and a continuing of the conversation that we've started, and one that's been happening for a long time, to perhaps for us to do some reflections on things when we haven't got it right, when perhaps we didn't have the tools to have the conversation as clinicians, as workers, as community members, as sector experts, and to think more expansively about family violence, so that as we work towards this shared goal of a vision of no violence in the future and minimising violence, that we leave nobody out of the story, and that LGBTI people can stand in the space of prevention and have those stories be heard, so that we can actually move forward in a way that's inclusive and we can work together. So I'm excited to see where we go from here.
Oh, I get a bit emotional working on this project, as I tell everybody. So beautifully said, Caroline, and thank you so much to all of you, to Carolyn, Starlady, Shane and Stephanie, for joining us here today and sharing your thoughts. I'm sorry that we need to wrap up at this point, but I'm just so pleased and excited for the next phase. This is the beginning of a conversation that has been happening, and we're moving into the next phase. We have all been doing this work in separate spaces, but where we go now is very important, and what we do together is very important, and it's so wonderful to be talking and hearing from and learning from all of you as we to my colleague and another author and key staff member on this project, Matthew Parsons, who's the Manager of Education and Strategic Development, who will close off for us today and provide some advice on where our those listening in the audience here today can do next to be part of this conversation. Thank you.
Thanks, Jackson. As you said, in many ways, we're all at the beginning of an ongoing conversation for LGBTIQ domestic and family violence prevention and service responses in Victoria and nationally. So here are some ways for all of you to keep having this conversation with us. If you haven't already, you can download Pride in Prevention from our website, and we encourage you to please share it with others. You'll also receive an email through our newsletter in the next couple of days with a link to the recording of this event. We encourage you to also please promote this further through your networks. We look forward to communicating to you in our newsletter in more detail about the LGBTIQ violence prevention training that Minister Williams announced today. Thanks again, that's fantastic. Finally, on behalf of everyone at Rainbow Health Victoria, we want to thank you so much for attending our launch for Pride in Prevention. We hope this resource can be the first step in us all working together to create a world where people of all bodies, genders, and sexualities can live free from violence. Thank you.